Hey there, I'm Katie Fiola-Jones. I am a certified Christian financial counselor, teaching you how to manage your money in light of the gospel so you can glorify God with all of the resources that He has given you. Now, if you are exploring different health cost sharing options, then this video is definitely for you. Because today I am going to give you a side-by-side comparison of two of the more common or more popular health cost sharing programs out there, which are Medi-Share and Christian Healthcare Ministries, also known as CHM. And to be totally transparent before we dive into this, I am a CHM member and I have been for many years. And I have honestly been super happy with my experience as a CHM member. And I actually have a handful of other videos about my experience as a CHM member, including a review of their maternity program, a video on how to submit bills because it's very different from like traditional insurance, and many more. So if you're curious to learn more specifically about Christian Healthcare Ministries, I'll drop links to all of those videos in the description box below for you to go and check out. But that being said, in those videos, I have gotten tons of comments from you asking about why we picked CHM over something like Medi-Share, and there's other programs out there. Another one is Samaritan Ministries if you're wanting to go and check out some others. And Medi-Share just happens to be one of the more popular, more common ones you may have heard about. I'm not here to convince you that CHM is the best of the best. I have really enjoyed our experience with CHM, but I can also see why other people pick programs like Medi-Share. So in this video, I really just want to give you a kind of comparison of their programs, just the data, just the facts of this program versus this, because I've never been a Medi-Share member, so I don't know what the experience is like being a Medi-Share member. I would definitely recommend checking out some other videos from Medi-Share members. One of those people who I really love and trust is Bob Loddick and his wife Linda. They have been Medi-Share members for quite a while. So if you're curious like what their experience has been, I'll link to at least one video of theirs where they kind of talk about that so you can get just a full spectrum. But in this video, I want to give you side by side what Medi-Share looks like compared to CHM, but just bear in mind that I am a CHM member and we've really been enjoying them. And as always, if you have questions about CHM, please post them in the comments below. I love getting your questions. Obviously, this video has come from the questions that you guys post on there. So if you have a question about CHM, I will do my best to answer them. I am not an employee of CHM. I don't get paid directly from them. I do receive referral credits when people sign up for CHM using my referral link. So if you are considering switching to CHM, I really greatly appreciate all of you who have used that link. CHM has actually personally reached out to me to just thank me for creating videos like this, just from a member's perspective, totally like not scripted by them or anything, and just how many people have used our referral link to join CHM based on the information that we've provided. So if you are someone who has joined CHM using my link, thank you so much. It really has made a tremendous impact for our family to make things like this more doable because it does provide us a little bit of a kickback. So I'm able to make more videos like this. So thank you from the bottom of our hearts. All right, so just a quick overview of CHM and Medi-Share. Christian Healthcare Ministries was actually founded in 1981. They are the original health cost sharing ministry here in the United States. It offers 4 different programs: the Gold, Silver, Bronze, and Senior Share program, each with a flat monthly pricing and different amounts for their annual personal responsibility, which is similar to a deductible. It works on a per incident sharing model. So this means when you have a specific medical incident, different things come into play, which we'll kind of talk about in the next section. They also do not have any network restrictions. So you get to choose who your providers are without needing to go with any network to get your bills shared within the ministry. Medi-Share is just slightly different. They were founded in 1993. It is one of the largest health cost sharing ministries in the United States at this moment. You've probably heard their name before on like a radio station or on TV or online. They are pretty well known and pretty commonly used within the kind of Christian communities. It's structured more like insurance, and I think that a lot of people jumping over from traditional health insurance find that a little bit more comforting because your monthly share, which is the monthly rate that you pay, is based on the annual household portion that you pay, which is similar to a deductible, whichever one you choose, as well as your age, your health status, and where you are located. They also use a PPO network, and so they really want you to work within a network. They have options to work outside of their network, but I think sharing is slightly limited when you work outside of that network. So you kind of want to stay within their preferred providers. These costs that I'm sharing with you are current as of the fall of 2025. We are coming up on a new year, and usually at the end of the year, they update their prices for the year ahead. So just be aware of that as this video comes out. You might need to go and check those. But CHM has their 3 primary programs, which are gold, silver, and bronze. The gold is $255 per individual. And then that's a $1,250 personal responsibility. The PR is similar to a deductible, and it is an annual price. However, every incident, like I mentioned, you have to hit a qualifying amount for that incident to be shared. So people get kind of confused on what those are because the personal responsibility often matches what the qualifying amount is. The qualifying amount just says that you need to have a medical event total up to that certain amount before it can be eligible for sharing. And then you have to pay the personal responsibility. Then their silver program is $148 with a $3,000 PR. Bronze is $98 per month with a $6,000 personal responsibility. And then they have their senior share program, which is only $115 per month. This is for those who are 65 plus. There is unlimited sharing and there is no personal responsibility. So with the unlimited sharing, each of these programs actually has a cap for how much can be shared within the ministry. The cap is $125,000. Now, if your medical incident goes beyond that amount, they have their CHM Plus program, which you can add on, which is $32 additional per month per individual. With Medi-Share, you actually have to apply to find out how much your monthly sharing amount is going to be, like how much you have to pay per month. This is going to be dependent on your age, your health status, your location, your household size, as well as your preferred AHP, which is your annual household portion. They range from $3,000 up to $12,000. So an example that I found online is that a healthy individual in their 30s, which was kind of where I was at, might pay $246 per month with a $3,000 AHP. Or they might pay $115 per month with a $12,000 AHP. So you have to go online, put in your information, apply to find out your specifics. Medi-Share will reward those who are healthier. So they'll actually take off $99 per month if you meet their health standards. You do need to take a physical, and it is based on weight, cholesterol, blood pressure, and pre-existing conditions that you have. So just keep that in mind as you are applying for their programs, that it is kind of based on your health status as well, which could be a good or maybe not beneficial thing, depending on how you view that. If you are 65 plus, they do have a program designated specifically for you. Now, it's worth noting that both Medi-Share and CHM have like a cap for family pricing, which is super, super great, especially for those who have lots of children. So the pricing actually is capped at 3 individuals per family. So that means a husband, a wife, and 1 child, which would, if you have 6 children, you only pay for 1 child as like an individual. Okay, so how do each of the programs handle medical bills? Medi-Share is going to be more similar to what you've been used to with traditional health insurance, where CHM is going to be a little bit more on that side of being a health cost sharing program where it's not insurance at all. So I'll start there. CHM, you actually pay your provider directly. So you go to the doctor and you tell them you are a self-pay patient. You pay your provider directly. Oftentimes, they provide you with lots of discounts because you are considered a self-pay patient. You then take those bills that you received from your provider and submit them to CHM, and CHM in turn, if those bills and if that medical incident qualifies, they reimburse you for everything minus that personal responsibility that you have. Again, the sharing is per incident. So each incident has to meet the qualifications to be shared, but then you have a personal responsibility that is an annual personal responsibility. So that means once you hit that, everything beyond, as long as it qualifies to be shared, will be shared without needing to pay that personal responsibility. Again, the exception for that is the maternity program, which does require you to pay another personal responsibility, and that is based on your program that you are a part of. The senior share actually has a $0 responsibility. They also have unlimited sharing, and the CHM Plus program does increase your sharing and then it helps with pre-existing conditions. But the whole way that it goes is that you actually deal with the billing department of every provider versus like CHM calling them. There are certain instances where CHM might actually connect with the provider, but the norm is that you actually talk with the provider and the billing department. Medi-Share is a little bit different. Again, they prefer that you work with their providers that they already have in their network. So they have a PPO network that they want you to work with. So you go to them, you tell them you are a Medi-Share member, and then they actually send the bills directly to Medi-Share, and then you're responsible for things after that. My guess is that Medi-Share then will bill you for it, but I don't know that 100% for sure. But again, it's similar to how traditional health insurance works, where your insurance, so in this case, Medi-Share, who is not technically insurance, they are working with the provider for you. So if the idea of talking with the provider in the billing departments is slightly more daunting for you, Medi-Share might be a better option because they do a lot of that discussion and negotiating for you. I personally have never been afraid of that and never have had any issues talking with providers. Now, we have had plenty of medical incidents at this point where we have gone in and we've had big medical events that we've had to manage. And I have never had any issues with that. I actually have a spreadsheet that I keep track of all of our medical bills on in order to make sure nothing slips through the cracks. If you're interested in those spreadsheets, I actually do share them for free. I'll have a link to that in the description box below if you decide to become a CHM member. So you can grab those to hopefully help you manage your own bills. Now, Medi-Share does have things like a small copay style fee for different providers, or like when you go to the doctor, you have to pay like a $35 copay, or for the ER, you have to pay a $200 copay. CHM doesn't do that. Again, you just pay the provider, and then depending on if it's eligible or not, you submit the bills to CHM, and then they reimburse you for anything that was eligible. Both CHM and Medi-Share have maternity programs. CHM now has their maternity program for all 3 tiers, their gold, silver, and bronze program. That was actually not the case just the year prior. It was only if you were on the gold program. I mentioned that there is a separate personal responsibility that they have per maternity related event. And so for the gold program, it is $2,500. For silver, it is $5,000. And for the bronze program, it is $9,000. So if you have a medical event and a pregnancy, you actually will be paying the personal responsibility for the year for that incident as well as for that pregnancy. So just be aware of that, because if you're on the bronze program, it could be that you are paying $15,000 as your personal responsibility, which is the $6,000 for the general personal responsibility, as well as the $9,000 for your maternity related personal responsibility. Now, from my understanding with Medi-Share, they actually a pregnancy is pretty much the same thing as a regular medical event. And so your costs for that labor and delivery and all the postnatal and prenatal and all the stuff, it all goes to your AHP, your annual household portion. It should be noted that both Christian Healthcare Ministries and Medi-Share, you must be a member of these programs before conception. So this is a big deal because a lot of people maybe don't have health insurance as a young individual. They find out they're pregnant and then they want to go join a health insurance plan so that way they have their pregnancy and everything covered. Well, with these cost sharing programs, that isn't really an option. So you do need to be a part of them before conceiving, as well as they both require you to be married in order for that pregnancy, the labor, the delivery, pre and postnatal and everything. In order for those all to be shared, you do have to be married. So that is something that when you are filling out the forms with CHM, at least, they do ask you. So when it comes to routine care for both of these cost sharing programs, they actually both provide an online telehealth option, which is really awesome. Christian Healthcare Ministries has switched over to a new telehealth provider called HealthTap. And when you go and set up a primary care visit, it is a $0 fee for that visit. Medi-Share also has a telehealth option. I believe that it is similar, that they do not have any fees associated with their telehealth option. I don't know that for sure. When it comes to routine care outside of these telehealth appointments, if you choose to go into a doctor's office, or when it comes to like things like annual physicals, Christian Healthcare Ministries does not actually share the costs of an annual physical. That is something that is expected to be out of pocket for yourself. CHM will cover sick visits if it is a part of a larger medical event. So if you go in, you find out you have some intense illness and then it requires more follow-up care or prescription and things like that, as long as then the whole incident qualifies under the qualifying amount for your program level, then that medical event can be shared within the ministry. Vaccines are not shareable. Some are when they are maternity related, but there's only a few of them. And then prescriptions are shared only if they're tied specifically to a medical incident. So a good example of that is when I had my knee surgery and I had a pain medication that was prescribed. That medication was shareable. However, if you have any ongoing routine medications that you are prescribed, those are not shareable within the ministry. They do provide discount cards for prescriptions. So hopefully that will help with the cost of any ongoing prescriptions. Medi-Share, a little bit different, but has some similarities. They do actually share annual physicals within their ministry. So that is something that's slightly different. I think they do, again, have a small copay for it. So you would have to pay that when you go to the doctor. So very similar to what you might have with traditional health insurance. Sick visits are eligible. And there would be a small provider fee, again, similar to like a copay when you go. Vaccines for them are not covered. And then prescriptions, they're a little bit different. So they actually do share up to 6 months per condition. And then anything after that, so long-term prescription that you have, is your own responsibility. And then what if you are 65 plus? CHM does have their senior share program. It is $115 per month. That price has actually stayed the same for at least the last 4 years that I've been making CHM videos. I usually do an annual update of how their prices have changed, and their senior share program has never changed prices. So that's kind of cool. They also don't have any deductibles. There is no incident limit. So that means they have unlimited sharing. You do have to be 65 plus. So Medi-Share has their Medi-Share 65 plus program is what it's called. The AHP for that program is $500. So they do have that annual household portion that you would be responsible for. The monthly share amount is based on solely your age. So if you're between the ages of 65 and 74, it's going to be $99. And then if you are 75 plus, it is $150. So with both Christian Healthcare Ministries and Medi-Share for these 65 plus programs, all of the features that are included in each of the other memberships are included in their senior programs. The main thing is that both of these programs are meant to work alongside of Medicare A and B. Now, this is a big one. A lot of people ask me about pre-existing conditions. CHM, I think, has a pretty favorable pre-existing condition program. And keep in mind that you'll need to kind of go and read a little bit of the information about what is a pre-existing condition and what is an active versus a maintained condition. They do have two options to get your condition shared. I'll post both of them here for you to pause and read through. So the first thing is being on the CHM Gold program and then having the CHM Plus program. So if you have that, there's kind of they have a step down approach to having those conditions shareable. And then they also have their CHM Gives program, which is super cool. And it's not only for those who have a pre-existing condition, but it's anybody a part of CHM who their medical bills maybe go beyond the sharing limits, which is that $125,000 cap. So if you have anything like the pre-existing condition or that goes beyond that, they actually post it to the CHM Gives page. This is where members are allowed to donate to CHM to go and provide for those Gives page conditions, which is super cool. I don't know the statistics now, but when I was doing a video, I did look it up, and 100% of all of those CHM Gives conditions that were on there, they were all covered, which is super cool. So if you do have a pre-existing condition, CHM is super favorable when it comes to that. From my understanding with Medi-Share, I don't think that any pre-existing condition is eligible until after 36 months of membership. After that, between the 3 and 5 year range, there's some limited sharing for that condition. And then after 5 years, as long as you don't have a reoccurrence of it, is what they said, then that condition is fully shareable. We've gone through a lot of information. Again, if you have some questions, please post them in the comments below, and I'd love to try to get them answered as best as I can for you. Again, keeping in mind that I don't know tons and tons about Medi-Share, but I'm happy to try to find out. Now, I just wanted to throw this out there because this was one of the really interesting things that I actually learned about during my research, is that one thing that kind of piqued my interest was that Medi-Share does actually provide some adoption assistance. So if you are a family who is looking into adopting, they actually provide, I think it was a few $1,000s in assistance for that, which was really kind of intriguing to me, being a foster parent ourselves and a family that has considered adoption. So that was something that was just kind of different. Both of these programs are meant for Christians. And I do know for Christian Healthcare Ministries, and I believe it is the same for Medi-Share, that each program does ask you to sign a lifestyle covenant. So as you saw with the maternity program, you do need to be married in order for that maternity event to be covered within the ministry. There are other things that both programs will not pay for if they do not align with the covenants. So one good example with Christian Healthcare Ministries is if you have any medical related incident that is related to drunkenness or due to drug usage, those incidents are not going to be shared within the ministry. So if that's at all of concern to you or your family, I would maybe just take a moment to pause to think about whether or not one of these programs is a good fit for you. You do need to sign the lifestyle covenant saying that you agree to that. And so it is just something to consider. It is honestly the way that both of these programs are able to keep their cost as low as they are compared to traditional health insurance. I would say that both of these programs focus more on larger medical emergencies versus a lot of the routine care that people are used to within traditional health insurance. So that is just another thing to think through and pray through as you are considering your options of where to park yourself when it comes to your health costs and everything. So we have really loved being a part of CHM for the last several years. It has been a really great fit for our family. We have just loved their faith focus. And if you do decide to jump into being a member of Christian Healthcare Ministries, please consider using our referral link that I'll share in the description box below. Our family does receive a small kickback for that. We super, super appreciate it. It really does mean a lot to us in supporting me making more videos like this for you. We're just going to sign off there. So be sure to subscribe to my channel if you don't want to miss out on any of my faith and finance videos and want some encouragement on how to glorify God with your finances. All right, I will see you next time. Bye-bye.